Are you an individual with only a lower grade of male pattern baldness? Are you planning to get a hair transplant procedure done but are skeptical about the number of grafts which might be used since you might have received different advice from different resources? I am going to discuss my surgical protocols for grades 1, 2 and 3 androgenetic alopecia, which would help you in achieving your long-term objectives, since I prefer using a conservative approach in order to preserve the grafts which might be used later on when you really are in need of them. Grade 1 and grade 2 hairlines may not be a true reflection of androgenetic alopecia. Some individuals are genetically predisposed to having an M-shaped recession or a high-lying forehead. This tendency of having an M-shaped recession or a high forehead may run in their families. There is no history of baldness in their ancestors. These recessions are a mere genetic trait and not genetic baldness. The hairline in these individuals who have this trait stops receding after a while once it has reached a pre-programmed location. There are no accompanying signs of baldness which include miniaturization, which means hair thinning, etc. elsewhere on the scalp. As you might already know, that grade 1 male pattern baldness is described as minimal recession of the anterior hairline. Grade 2 male pattern baldness is described as early recession in the temporal areas on each side of the head. These areas of recession are more or less symmetrical and lie in front of an imaginary line drawn to join the two ears on each side of the head. This imaginary line forms a vertical coronal plane. Patients with grade 1 and grade 2 baldness should not get their hair transplant procedure done just yet. This is due to the fact that they have not yet developed a stable pattern of baldness and often they are less than 25 years of age. In grade 3 male pattern baldness, there are deeper areas of temporal recession on each side of the head. These areas of recession lie behind the imaginary line drawn to join the ears on each side of the head. There is also accompanying frontal recession of the hairline. In these patients, we draw the hairline both during consultation as well as on the morning of the day of the procedure. Though around 1000 to 2200 scalp grafts may be required for restoring the hairline, of these 350 to 380 grafts need to be single head scalp grafts. Only single head scalp grafts can be used in the leading two rows of the hairline to give a pleasing, natural looking transition. The total number of grafts would eventually depend on where the hairline was mutually agreed to be placed and how close the temple points will be, always keeping within the confines of the acceptable norms of hairline design. The number of grafts to be used in the mid-scalp would depend on a number of factors, which include the availability of grafts, the future pattern of baldness in the patient, and the long-term objectives of the patient. Anywhere from about 1000 to 2000 grafts may be used to cover the mid-scalp region and seamlessly merge it with the restored hairline. Additionally, some patients might be concerned about their temple points. These patients can benefit from the placement of about 150 to 200 grafts at the temple triangles for better added density. There are a few young patients who end up finding small imperfections along their hairlines. These small imperfections might be a result of mild traction alopecia, which occurs in those people who wear their hair in the form of a tight bun. There might also be certain areas of unevenness along the hairline, or there might be effacement of a part of the temple point, which makes both sides of the head appear somewhat asymmetrical. Provided the patient is above 25 years of age and does not show any signs of progressive baldness, these small imperfections can be corrected, as is done at Five Rivers Hair Transplant Clinic. Thank you for your attention.